So, in hepatobiliary cancers, pancreatic cancers, gallbladder cancers, surgery is usually the first treatment or the mainstay treatment in these cancers. So, once surgery is done, then once we get the complete report of what surgery and how what was the cancer taken out. So, once we read that, we see for any risk factors or any high risk features that tells us, okay, this cancer is a little aggressive. It has some chance of coming back. So in those cancers, we recommend giving some extra treatment in the form of radiation therapy with or without chemotherapy. So in those cases, radiation therapy is generally given. But some patients, what happens is the hepatobiliary or pancreatic cancers, they are very extensive. That is, they would have, even though they wouldn't have spread to any other areas, but in that area around the stomach, around the pancreas, around the liver, it would have gone and invaded other critical structures such as blood vessels or stomach or some other areas in which surgery cannot be done because entire content or entire cancer we may not be able to remove. So in those cases, surgery is not done because even if you do surgery, if you're not able to remove the entire tumor, then it does not serve the purpose. So in those cases, radiation along with chemo or sometimes without chemo is the main treatment in those patients. So sometimes also if the tumor has spread to some other areas, radiation is also used as palliative RT. That is, to that area, if there is a large mass, the patient is having some amount of jaundice, severe pain, then 10 days of radiation can also be given in some cases of metastatic diseases. Now, because that area is a little critical, because there is a lot of blood vessels behind it, the large blood vessel, what we call the aorta, is there. Then there is liver on the other side. This side there is spleen, there is stomach. Above there is diaphragm and lung. So because all the that area is a very compact area with a lot of blood vessels, lymph nodes, etc. running, in those cases, ideally a better technique of radiation is preferred, such as IMRT or IGRT is preferred, or a VMAT is preferred, because we need to avoid certain areas in those that in that area. So we have to give maximum dose to the cancer, whereas a minimal dose to the surrounding areas. So generally, IMRT or IGRT VMAT is preferred. In liver cancer or hepatocellular carcinoma, what we call, or in simple terms, liver cancer, there is also an indication for a high-end technique such as stereotactic body radiation therapy, that is called SBRT. So if the tumor is very small, so only radiation can be given to the tumor, a very high dose radiation in a small area, a short duration of treatment. So that radiation is also indicated. That is more commonly indicated in liver cancers. So whenever we give radiation therapy, how many days do we give is another point. Generally, around 5 to 6 weeks of radiation is given in any liver or any other pancreatic or gallbladder cancer. In liver, if you are planning for the high-end technique SBRT, what we do, that again has its schedule somewhere between 5 to 10 days. We can finish the treatment, sometimes even less than that.